Hello, everyone. Good afternoon, good morning, good evening, depending on where you are watching or seeing this video and the time. All right, so a quick one. I want to let you know about the best sleeping position for a newborn or for infants or children between the age of 0 to 1 year. Their best sleeping position is lying them on their backs. That is the best sleeping position. It is very, very alarming to hear that infants just die all of a sudden during their sleep. It happens. That is what we call sudden infant deaths, SIDs. And it happens sometimes because of this kind of carelessness. Most of the mothers, growing up and all of that time passed, mothers usually say that their children sleep more when they are lying on their tummy. And this is not a very good practice. It's a very bad one. Children can still sleep very well, even lying on their backs. That is the safest position for a newborn or an infant or a child from birth to 1 year. They need to sleep on their backs to help with breathing. When you sleep on your back, your nostrils are up, air will come easily, and it would avoid or prevent suffocations and all that. So you need to lie your baby on their back. Lie your babies on their backs so that they can sleep well and they can also breathe well, and it will make their airways to be patent, to be open enough for air to come in. But you lying them on their tummy could pose the risk of SID, which is sudden infant death. When they are lying on their tummies, maybe, for example, they want to shift their cheek to the other side, because most of the time you put their cheeks down because they are lying on their tummy. When they want to shift to the other side, their nostrils could get stuck in the mattress, and it will prevent air from coming. Before you know, the child suffocates and dies. I have seen so many situations where parents rush their newborns or their infants to the hospital, and getting to the hospital, they are already declared dead. They say, oh, they were lying down, they were sleeping, and all of a sudden I saw he was not breathing again. And then we ask, how was the child laid? They say, oh, he was lying on the tummy. And this is one of the problems. These are the ways children can die all of a sudden without sicknesses. And it's carelessness. Even the World Health Organization advises that children should be laid on their backs. So you don't need to argue that. Some people will say, that is how our parents did for us, even in times past, and we are strong today and all. No, you don't look for ways to justify misconducts. These are very bad ways. You are just trying to put your children at risk of sudden deaths, and is not a good one. Please start lying that child on his or her back from henceforth, and they can still have a good sleep. And another thing, I would also encourage that the mattress where you lay your children should be firm, not too soft. It should be very firm, and make sure the bed sheets are well fitted, because children, their hands are always engaged. They're always using their hands all the time. Maybe they wake up suddenly, they could be looking for attention or trying to cry and grab a cloth on the bed and use it to cover their faces, and they could suffocate. So lay them on their backs, and also make sure there are no extra cloths on the bed where they are laid, and make sure that the bed sheets are well fitted so they cannot use it to cover their faces when they are awake or looking for attention. So please stop the habit of laying children on their tummy. It is not advised. The World Health Organization has already given us a laid down guidelines on how to best lay our children for sleep. And make sure that when you are going to bed at night, your child is in the same room with you, but not on the same bed. Please let their bed be separate. Because we have some mothers who don't sleep, they sleep so roughly on the bed. I've heard a time where they said a mother mistakenly laid on the child, and the child sustained a kind of, was it a sprain or something like that, and was having a lot of pain. So don't sleep on the same bed with your child. You can sleep in the same room, but let the child sleep on a separate bed, a firm bed, and a well-fitted bed sheet, so that they don't suffocate or they don't grab any cloth or whatever and cover their faces. Please take care of your little ones so that we don't experience this kind of problems like sudden infant deaths. They are very deadly. It can be very painful, just seeing a child die all of a sudden without any sickness, without any kind of diagnosis from the doctors, just because of sleep. Is very bad. Don't argue it. Just do the right thing. Begin today. Lay that child on his or her back, and you see that they will breathe better, and the problem of sudden infant death will be solved. See you next time.